Sandra, this is Kevin Dragato.
Yes.
How are you?
Yes. Hi, Kevin. How are you?
Good. Ann McDonough is on a Teams meeting. I think when an invite was sent out, it also had a Teams invite link. So I just wanted to make you aware of that. I'm going to let her know to jump on Zoom, but there may be other people that are experiencing that same issue.
Oh, okay.
So let me jump on with her though.
I'll wait like 5 minutes or something.
Sounds great. I'll communicate with her.
Okay.
Thank you.
Thank you, Kevin.
Sandra, do we need 3 for quorum or 4?
I believe it's 3.
Okay. Good.
So we are good. We're going to wait for just about 5 minutes because some of the links that went out were for a different kind of meeting. So Kevin Dragato's working on fixing it. So. Did you hear me, Amy?
I could hear you, Sandra.
Okay. Hi, hi, Adam.
How are you?
I'm good. I'm out of town, so I'm hoping I don't have technical issues, and it seems like a so.
Yep, I can hear and see you just fine.
Okay, good. We're waiting, anyway, we're waiting for 5 minutes because there was a little confusion about the link that was sent out apparently. So Kevin Dragato's working on fixing it.
Thank you.
I did send that link out to Ann McDonough, and
Okay.
anybody else who needs it, just let me know and I can post it in the chat. You guys can copy and paste it to whoever might need it.
Okay,
In fact, I'll just go ahead and post it to the chat in 1 second.
thanks, Kevin. So with that kind of taken care of, I think. So we're just going to wait until 4:35 just to give people a chance to get on this other link. So just bear with us for a few minutes.
It appears as though Supervisor McDonough was able to connect to this meeting, so I believe we should be good to go.
Okay. Well, thank you. Thank you for your help, Kevin. Then we will go ahead and call the meeting to order. It is August 17th, and I believe the time is around 4:33 p.m. I will take roll call, starting with Adam Hoffman.
Here.
Jessica Smith.
Here.
Amy Crow-Sunleaf.
Here.
Sandra Larson. Here, and we were notified that Dr. Schultz had a conflict in his schedule. At this time, anyone may address the board on matters which are on the agenda. Please raise your hand on Zoom, state your name and home address, and individual remarks will be limited to 3 minutes. And I can't see everyone on Zoom, so. Laura, do you see anyone raising their hand?
I do not thus far.
I don't either.
Okay, seeing none, we will go
Oh,
ahead.
there is
Kathy might
one.
have her hand raised.
Yeah, Kathy
yeah.
has her hand raised.
Who?
Kathy. Kathy, you need to unmute.
I think the host may have unmuted her. I don't know. Maybe not.
I've asked her to unmute.
Okay, I went ahead and unmuted.
Okay, would you please state your name and your, the street that you live on?
Kathy Haverland, 10531 Key West Drive.
Okay, and you have a comment about something that is on our agenda tonight.
Yes, we have a comment about needing a variance for a septic system to be placed. Our septic system
Okay,
that we
and-
have. Do you want me to go ahead?
So you're on, is your matter on the agenda tonight? What's
Yes.
your name again?
Kathy.
Yes, all right. Okay. We'll go ahead and call on you when we're discussing that, okay?
Okay, thank you.
So we just sit here. They'll come back.
Okay, are there any other public comments concerning things on our agenda tonight? Okay, hearing none, we'll go ahead to chairperson announcements and updates. We have here to update on the appointment of 2 new Board of Health members. And actually, I know that we were sending out a press release concerning the fact that there were 2 openings, but I don't have anything else to report on that. So we can go ahead then to the Board of Health Liaison Comments. Supervisor McDonough, do you have anything tonight?
I do not. The auditor, I believe, is with us. He may know if the applications for the board are on an upcoming agenda. I'm not aware of the status of that.
Okay, thank you.
This is the auditor. Those will be coming up. I do not believe they're on a board agenda this month, but I will send an email out to you, Sandra, to disperse or to Laura to disperse regarding the status update on that.
All right, thank you, Kevin.
No problem.
The next item on the agenda will be the approval of the agenda. And I wanted to just make one change. So I'm making a motion to, under number 9, under unfinished business, I would like to add A1, and that is a discussion with the city of Dubuque. So we'll just, that's a motion. Is there a second to that?
I can second. This is Jess.
Thank you. Any discussion? What we just need to discuss some things with concerning the disbursement of information and that type of thing. And so we're going to just add this to the agenda tonight so that we can start our discussion. It'll be something similar to what we have with BNA, only specific items where they can help us until we have a new director.
Sandra, do we have a quorum?
We had 3 people. So we had Adam, Jessica, Amy, and myself. So we
Okay.
had 4 people. So yes,
So we have 4 of the current board. All right. Thank you.
correct. Okay. So any further discussion on that?
Chair Larson, this is the auditor. You do have a motion on the table for an amendment to the agenda.
Yes, we do. So that's what I was saying. Is there any further discussion on that motion? We had a motion and a second. Hearing no further discussion then, all those in favor of amending the agenda, please say aye.
Aye.
Aye. Those opposed? The motion then passes, so the agenda is amended to add 9A1, a discussion with City of Dubuque Health Department. Okay, let's see. The next thing then will be the approval of the minutes, and we have 2 minutes, 2 meetings to approve. That would be July 20th, 2022 and August 1st, 2022. Is there a motion to approve?
I move we approve both sets of minutes.
Thank you. Is there a second?
This is Adam, I'll second.
Thank you. Any discussion? Hearing none, then all those in favor of approving the 2 sets of minutes, please say aye.
Aye.
Those opposed? Okay, the motion carries and the minutes for July 20th and August 1st, 2022 are approved. The next item on,
Sorry.
okay, the next item on our agenda is the presentation and reports. First of all, we'll have response to public comment or questions from the previous meeting. There was a question at the previous meeting concerning variances and how we decide whether to approve the variance or not. And so I don't know, is Bailey on tonight? I don't think she is, but
Bailey will be on shortly with regard to the variance
Okay.
request. But
okay,
what I had was the question being, can you clarify variances? And I do have an answer from the chapter from that, for that rather.
okay. Oh, yeah, yeah, go ahead, Laura. I'd appreciate that.
Okay, give me just a second. And okay. Can you guys see that?
No.
No,
I'm not sure why it's not sharing. Oh, here. Sorry. Okay. So 567-69 variances. Variances to these rules may be granted by the Department of Natural Resources or the administrative authority, provided sufficient information is submitted to substantiate the need for and the propriety of such action. Applications for variances and justifications shall be in writing and copies filed with the department. ARC 7569B, IAB 21109, effective 3/1809. These rules are intended to implement Iowa Code Chapter 455B, Division 3, Part 1. That's really all I have on that.
all right, well, thank you. That it shows that the person who's applying for the variance has to show a need, and then they have to also prove the propriety or the whether it's justified or appropriate to grant that variance. So that's the standard that we kind of follow, and I appreciate your help with that, Laura.
No
And I don't
problem.
believe there were any other questions from last meeting. So tonight we don't have any guest presentations, but we do have Laura, who will be presenting the Dubuque County Health Department monthly update. So you can go ahead with that, Laura.
But before we do that, did we ever hear back from CJ May, County Attorney May, about precedent?
We did, and Bailey is going to share that when we discuss the variance for that property.
Okay, thanks, Laura. Go ahead.
You're welcome. All I really have to share is since last meeting, we've done 27 additional water testing, and that's been going really well. I have taken my test to be certified for lab testing, and I will have those results by the end of the month when the test closes. I believe it's like end of next week or the following week.
Great.
And that is all that I have.
Thank you, Laura.
You're welcome.
Next on the agenda is the VNA monthly update and COVID-19 update with from Stacy Killian.
Good evening, Sandra and board. Can you hear me okay?
I can.
Perfect. So I will get started with just a VNA report. And I think going forward, I may kind of combine the COVID and the VNA in one written report, which I think would be easier for you guys to have that information ahead of time. But we'll
Okay.
start this way and we'll get better as we go along.
All
So
right. Thank
you bet. For VNA, we've been pretty busy actually over the last month. In our tobacco prevention and control grant, we've actually had a lot of contacts with child care resource and referral and doing some policy trainings, which 12 child care centers attended, which we thought was fabulous. We've been working with area substance abuse council and doing quite a few outreach events throughout the community, including the Dubuque County Fair. VNA had a table there all week and we're able to promote a lot of programs. And we have begun work with the schools and to schedule tobacco education. And we currently have 10 signed up for our quarterly tobacco diversion class, which will be held on the 27th of this month. In terms of funding, 6% of the grant has been spent and the grant ends on June 30th. Immunizations, we've got quite a bit going on here as well as we're gearing up for back to school. First, we've had 250 children vaccinated in July with 485 vaccines administered. We're averaging right about an 11% no-show rate, which is something that we work on quite a bit to get that as low as possible. 66% of the grant has been spent already, and that's pretty common. The grant is only $18,000, so it doesn't go very far. We start here and then we supplement those funds throughout other funding pockets that we have. Our Care for Yourself BCC and Wise Women program, we're still currently in the grant year for Wise Women. That will end September 30th. We just submitted that grant for the upcoming grant year at the end of July, so we'll be hearing back for that. We started our Care for Yourself BCC July 1st. We've already have 22 participants enrolled, which is wonderful. We've completed 4 health coaching sessions in July and 1 post-evaluation. So I feel like we're doing really good start there as well. And we're working with Iowa Department of Public Health on securing some additional outreach funds for there. We work a lot, especially with the Marshallese population and some of our outreach throughout the community. For our local public health services, we've had some staffing changes. We are down 1 full-time home care aide, which is really difficult. We have that position posted and we're actively recruiting for applicants for that, but we did serve 60 patients, providing 155 homemaking visits and 72 home care aide visits. We have 56 individuals on the waiting list, and part of that being down 1 full-time staff really impacts that quite a bit. Communicable disease has been very busy, particularly our latent TB cases. We had 15 this month, which is up 53% from the previous month. So that's actually a good thing. I think that shows that we're increasing testing in the community, increasing awareness, and helping find more individuals that we need to provide some follow-up on. So we have our 3 direct observation therapy that come in, or we deliver the meds every single day, and we're working to get through the 15 latent as well, and partnering pretty closely with Crescent and some other providers on making sure that all the testing needed and all the follow-up is being done on the medical side. In terms of just some agency information, we had 48 individuals present in July for triage services not related to any VNA programming. That's down a little bit from the previous month. As I mentioned, we had a 53% increase in latent TB follow-up. And our VNA FTEs are currently below budget by 4% because we've had quite a few positions open. We had a total of 8 in July, including 6 just in our Dubuque office. We had 2 dietitian positions, 1 part-time case manager position, an RN position, a department secretary position, and then our full-time home care aide. So far, we've filled 4 of those positions, and we are excited to welcome the new members. We are actually bringing in a lot of the WIC staff from Hillcrest. We'll be bringing over to VNA, which I think will help with that transition come October 1st. Go pretty smooth so we can get started on doing our WIC clinics beginning. I think our first clinic is October 3rd. So we're getting our space together. We've got the schedules out, and I feel like we're in a really good place there. Staff is very excited, and we'll be spending most of September training our current staff with that, and then inviting and welcoming our new staff to help bring that on. So this we anticipate will bring probably an additional 3,000 children in through our doors, and having the immunizations here, the maternal and child health, I think will be a big benefit for all those coming in. So we're excited to go through the bumps and get a smooth transition and get these kiddos seen. So we are currently working on that. We've spent quite a bit of time doing some outreach out in the community. Like I mentioned before, the Dubuque County Fair, we were also present giving COVID vaccines and giving out information at National Night Out at the beginning of August and the Back to School Bash as well. In terms of emergency preparedness, we're continuing to participate on the after action report and planning and contracting. We've met with the contractor, John Carter, several times. Our incident management team has, and we've begun getting him all the information. We anticipate over the next couple of weeks, he will begin to start contacting some of our close partners, many of which will be here on this meeting as well. So more information to come on that, but we've got a pretty good timeline going with John and his team, and we look forward to continuing to work with him and getting that after action report for COVID out. We're attending our emergency preparedness planning meetings with both our incident management team here locally and then as a region as well. And so that's kind of what VNA has been up to in the last 30 days. One other key thing to bring up is our immunization audits. We just received notice from Iowa Department of Public Health that our audits for the 2022-2023 school and childcare year are coming up. Our school audits will be need to be completed and submitted to Iowa Department of Public Health on October 28th. And our childcare audits will be due in January 27th of 2023. So this is a little bit earlier than last year, which is a lot earlier than the year before. So we have sent that information out to our nurses, and they have been in communication with the schools first, and we'll hope to get in there as quickly as we can and help them get prepared as they start the school year, and then get those audits completed and submitted to the state on time. And then if you give me a moment here, I'm going to share my screen and we can do the COVID report as well. So, okay, I can't tell. Can you guys see the COVID report?
Yeah.
Yep.
Perfect. So I'm using the same template that has been used in the previous, and I added quite a bit of information on both COVID and monkeypox, as we've started to see a lot of calls in the community, a lot of fear and some misinformation on monkeypox. So we are currently working on getting more information out, both through our incident management team and through the nurses here at the VNA too. So for COVID, our community level is moved back down to a medium. For a while there, we were in high, but we have moved back down. And as you can see, some of our surrounding counties have as well. So good news there. Our variants by month, we're continuing to see the Omicron variants as we have over the last several months here. Not any changes there really from the last time that we reported. As you can see in our positive COVID case trend line in Dubuque County, we had a large increase in the January-February time period and then a small dip, and we've stayed pretty steady with some slight dips here and there throughout the summer. Our COVID cases in the last 7 days, and this was last updated on 8/10, was 153 cases. And this morning we sent out the newest information updated from 8/17 to 136 cases. So another slight decrease. It's what we would like to see is it continue to decrease week to week. But that's our information the last 7 days. Our hospitalizations through 8/10 were 10 and actually reported out today. We're down to 9. So down again, a slight decrease there with hospitalizations as well. Our vaccination data, there hasn't been a lot of changes since the last month we reported. We had a slight increase in vaccines, but it is very slow moving at this time. We still continue to offer the clinics and the people are still coming in, but we are seeing very few first doses and very few young children, which is not really surprising, but we are seeing just slight increases. And this is our booster data as well. Again, slight increases here for those that need the booster dose and have received it. We will be sharing more information on the bivalent booster dose that will be available most likely in September in the next coming days as we get more information from Iowa Department of Public Health. And that bivalent vaccine will be the booster dose that is Omicron specific. So I think most people have heard of that in the news, and hopefully we'll have more information within the next couple of days. Our VNA report in terms of COVID, as you can see from the previous week, we went down by half for the number of vaccines. I don't anticipate when we report out tomorrow that we will see much increase there, but we are still continuing to offer the clinics. We were out in the community at the National Night Out and we did receive 2 vaccines. So we were excited to see that. Our calls have stayed kind of up and down. One week we might see a little bit more coming in. This week we really only saw 9, but we are continuing to do those. We are continuing to give out the test kits and try and look for community events that we can offer these vaccines at. And the newest report will come out with the IMT report on Friday sent out. Our IMT team also worked at developing a child care handout. We thought it was important with the increase and with the expansion of the vaccine to the younger kiddos that we would target the child care centers. So we did develop this and it went out through child care resource and referral out to all the child care centers. And we're also having some printed that will be hand delivered by our child care nurse consultant here at VNA. CDC recently updated their guidance, and unfortunately on their website, not all of these updates have been put on there, but really what it's looking at is instead of looking at mass prevention, it's preventing severe illness. And so quarantine is no longer required for an exposure, wear a mask for 10 days and test on day 5 if symptoms were to develop. Positive cases, there really is no change there. You're isolating still for the 5 days, wear a mask for the additional 5 days if symptoms until some have not improved or throughout that time. Continue to isolate, obviously, if symptoms are not improving. Avoid the immunocompromised. Moderate to severe illness should really truly isolate for those 10 days. So again, it's kind of moving away from the large mass information and looking more at how to prevent severe illness on an individual basis. So we hope to see more information updated on the CDC website soon. Monkeypox, I did add a little bit more information, like I said earlier, on monkeypox, because we are starting to see a lot of calls come into our office. At our recent community events, we had a lot of questions, particularly from the teenage group, which we were very interested to see. A lot of fear and a lot of misinformation. Right now, cases total in the US are 12,689. In Iowa, we have 15 cases up to date, and I believe the last time Sam reported it might have been 4. So we've definitely seen a little bit of an increase over the last month. I included, and when I send this out, all the links to the CDC. So you can take a look at the symptoms. Obviously, rash is a big symptom there. Painful, it can be itchy, fever, chills, exhaustion, headache, some respiratory symptoms. You may experience all, you may experience some. If you're sick with monkeypox, it's recommended that the symptoms would usually start within 3 weeks of exposure. If someone has flu-like symptoms, they'll usually develop the rash within 1 to 4 days. The illness typically lasts 2 to 4 weeks, but I think a lot is very varied depending on how fast you move through that rash. There is no treatment specifically for monkeypox. However, there are drugs and vaccines that are developed to treat and protect. So what we do know from Iowa Department of Public Health, should we get a positive case here in Dubuque County, VNA will be notified by Iowa Department of Public Health. Follow-up will be done out of our office, including contact tracing for those that may have been exposed. Anyone that Iowa Department of Public Health deems at high risk will have vaccine offered to those individuals. We are not offering vaccine to the general public, which is a question we're getting quite a bit as of right now. That may change in the future as more vaccine becomes available from the federal government, but we do have that process down pretty well. We've trained all of our nurses here. We've pulled the follow-up from our epi manual, so they're all aware and we're ready should a case come through to handle that. If you're sick with monkeypox, taking care of yourself, keeping the rashes bandaged. There's a lot of information on what to do if you're sick on CDC. I included that link below. Preventing the spread to others, there's a lot of information here as well, including on the website. It does divide out if you're living in the home with someone, if you're sharing a restroom with someone, if you're in, at work with someone. It kind of goes through all of that guidance and what your risk is. But basically, you're advised to stay at home if you have those symptoms. A lot is going to depend on how fast you move through that rash and whether it's healed and a new layer of skin has formed. I do know as we follow up with any positive monkeypox cases, we will be following up with them twice per day for at minimum of 21 days. So there'll be a lot of contact between our office and any individual that's positive, as well as their close contacts. That is kind of the COVID and monkeypox all condensed in there. And I will send out this PowerPoint to everybody at the conclusion of this meeting so you have it. And we can also make sure that is included in the written packet going out prior to this meeting moving forward. So any questions for me?
I don't have any. I appreciate all that information, Stacy, and all the hard work that you are doing at the VNA with your staff. We do appreciate it. Are there any questions from the rest of the board?
Stacy, this is Jess. Do you have any more information on the timing of the new vaccine with respect to boosters? I hadn't seen anything, but I saw your emails earlier, so I didn't know if you knew.
Yep. So you saw the emails we sent out earlier because we did get a health alert today to pre-order for the county. So as Jess mentioned, I sent it out to all the vaccine providers this afternoon. We are asked to have our pre-order in by Friday with more additional information coming on Monday. But my best guess is that it clearly isn't going to be sent out until after the EUA is approved, but we are assuming sometime early September to mid-September.
Thank you. Any other questions, board members? If not, we appreciate that report, Stacy. Thank you very much. We're going to move on now to the action items under number 8. The first one is the variance request. Greg Adams requesting a variance in Country View Estates.
Hi. So at the last Board of Health meeting, the board requested a recommendation from the county attorney for the 4-foot variance to keep the existing septic tank at the property at off Hales Mill Road.
Yes.
I did get a recommendation letter for the county attorney. Laura, could you share that?
Yeah. You're talking about the email?
Yep.
Yeah. Can you guys see that?
Yeah, I can.
Okay.
Yes,
I can't. I can just see the
I
screen
just see
that
that, yeah.
says CJ variance shortcut.
Well, there's several emails that I think Bailey's going to touch on.
I'm not seeing any of the
Okay,
emails.
I can just read them. I'll read them. So I emailed Corey or CJ on Thursday, August 11th. And so I just kind of gave him a background on everything. And he said, I am no expert on septic system or drain fields. That said, I would have concerns with reducing the distance by 60%, 10 foot to 6 foot, or 10 foot to 4 foot. There must be an engineering basis for the minimum 10 foot, and altering that may compromise the efficacy of the entire system. Perhaps you could require Mr. Adams to produce a sworn statement from a licensed septic system installer that this reduction would be acceptable. My other concern is that making an exception here would establish an unwanted precedent in the consideration of future cases. The minimums are there for a reason and need to be enforced. And then I did email him back. And I just wanted to clarify that the distance of the septic tank would be 6 feet. So he's requesting a 4 foot variance. I agree with not wanting to set a precedent, but on another note, that's what a variance is for in cases like this. The ultimate goal here is good construction practice and the welfare of public health. For the specific variance request, I do not see there being a compromise to public health. And that's what that was CJ's recommendation.
Okay, thank you.
So one of my concerns with this, just in general, with retroactively doing it is, I mean, with respect to good construction practice would be to identify it before. Because if you're doing construction on a house and you don't know where septic is and you're driving over it, that can certainly damage septic. So I think best construction practice for sure is to identify where it is so you can not harm it during construction. So what I think would be important just to double check that post-construction septic system is working properly. Yeah, that would be my concern. And I think that's the whole point of identifying it and getting this variance before any construction takes place. Then you're at least aware where it is and you can take measures to mitigate anything that may happen during construction and avoid that area and stuff like that.
I do agree with that.
Does anybody else have any comments?
Bailey, did we get anything from the certified contractor or whatever County Attorney May recommended as far as the safety or efficacy of where the septic is located?
So I just got this email back from him today. So no, Greg did not get that, but he is, and Greg is on Zoom. He is willing to get that. If that would be helpful, he said he is willing to do that.
Because for me, that would be helpful for me just to show that it was still functioning fine. Because in theory, the 10 foot to 6 foot isn't a deal breaker for me.
Right.
It's just I would be a little bit concerned if septic was damaged during that or something like that, and then homeowner, because it's going to be sold again, so new homeowner has this damage system that the county okayed. That would be my concern. It's not necessarily the 10 to the 6, but the construction done without regard to where it is.
Right. No, I agree.
Could someone remind me, if we didn't grant a variance, what would it take to fix this problem? Does anyone know?
Yeah, so if you didn't grant the variance, then he would just have to replace the septic tank and just put it in a different location. So that one would be crushed and filled with sand. And they would just pretty much start over with a brand new septic tank.
Okay, and how
A
old is
pretty big
that one?
expense, that's the issue, yeah.
Yeah,
Yeah,
the
how-
expense.
How old is that tank that's in there?
I believe it was installed in 2001.
Okay, so 20 years.
Will
Okay.
you remind me, Bailey, is the drain field being redone? But
Yes,
yeah,
the drain field is.
yeah.
I would just personally like to see due diligence done with a licensed contractor coming in and showing. And that way the precedents will have this other piece to it, that we're not just granting it, but we're saying we're granting it because of this extra step that was taken.
And what specifically, I think we got to take the language from CJ May's letter, maybe. What do we want the licensed contractor to verify?
Let's see. Just to verify that, you know, what they think about the variance, and, you know, kind of look over the septic tank, and if it's, you know, the overall condition of it. I mean, if it is really not in good shape, then
Well,
someone.
What was the language that CJ said in his
Oh.
email?
Perhaps you could require Mr. Adams to produce a sworn statement from a licensed septic installer. So I guess, well, yeah, there are some licensed septic installers in Dubuque, but we don't require it right now in Dubuque County.
Okay.
And I think
So
this
he
is a
could.
special consideration because it's already been dug, or it's already been, you know, the variance is coming after it's already been established. And so I think it's just a different circumstance than what people who are coming in before it's the septic's been dug or the variance has been requested. Does that make sense? Am I saying that in a way that's making sense?
Right.
Yeah.
This is after the fact, so the facts are a little bit different, but we want a septic installer contractor to verify the condition, the working condition of the septic tank. Is that what we're trying to do?
Yeah, and I mean, so if it's not.
I think something that it's not damaged and in good working condition.
Okay, not
Yeah.
damaged. Okay.
And then
I
he
like-
mentioned that if the reduction would be acceptable. I don't think that the variance is, I mean, we grant variances all the time, so I don't necessarily think that that's the problem, but yeah, definitely the condition and. have
Okay,
them look
so
at-
Amy, is that okay to add to your motion then that we want the licensed septic, I'm sorry, it doesn't necessarily need to be a licensed one, but a septic installer to verify that the septic tank is not damaged and in good working condition?
Yeah, I think it just shows due diligence all
Yeah.
the way around.
Yeah. Okay, is there a second to that motion?
I'll second.
Okay, is there any further discussion?
This is Adam, I'll second.
Yes, there's been a second, and is there any further discussion? Hearing none, then all those in favor of the motion, which would require the home owner to get a septic installer to verify that the septic tank is not damaged and in good working condition.
Well, actually, I guess I do have some discussion now that I
Okay.
think about it. I'm just wondering, so we don't have to wait another month, if when we get this letter or whatever, we're gonna get the inspection, if we can give Bailey the authority to okay it and then the project can go forward instead of having it go before the whole board?
Yes, that can be a friendly amendment to your motion. So You have a motion that Mr. Adams will get a contractor to verify that it's in good working condition. And we're granting the variance pending that notification. How's that?
Mhm.
I'll
That
still
sounds-
second that, and I like that idea, Amy. Thank you.
Okay. All right. Any further discussion? Hearing none, then all those in favor of the motion say aye.
Aye.
Okay, the motion passes. So Mr. Adams can go ahead and get us that letter, and as long as we get that letter, then his variance is granted. Okay, the next thing on the agenda under action items is the VNA contractual support for interim executive director position. Okay, so this contract was developed between Samantha before she left and Stacy. And it has been reviewed by CJ, I believe, and it's been reviewed by some people. I think, Stacy, you've had it reviewed by some legal counsel. So maybe, Stacy, you can kind of explain what the contract says, and then concerning the money figures, I think that's on page 2 of the agreement. Let's see here, let me pull it up here. Yes, on page 2, under number 3, the salary and benefits, administration fees and total. I'm assuming that if we choose to approve that, we can, but it'll be subject to somebody else's approval in the county, so. All right, Stacy, can you kind of explain what this contract says?
Sure, absolutely. So following, I think it was the August 1st meeting with the Board of Health and the discussion of having BNA provide interim executive director support to the county. I did meet with Sandra, Samantha, and Laura. Samantha was able to start a draft of some of the things that she felt were needed to be covered by the county during this time, which included management of our grants, which is something that we are currently doing now, just some overall management, which included signing authority for those grants, contracts, and amendments, and then also submitting and signing off on any reporting as well. She did include information regarding participation in county staff and community meetings traditionally assigned to the director. Some of them we are already participating in more as a participant role rather than a leadership role. Working with and continuing to work with our 6-year public health emergency preparedness. Providing public health updates, obviously, to the Board of Health and members of our community, working as a public information officer within the county and being able to speak with media on behalf of the county and providing updates. Supporting the health department staff through their annual budgeting process, as well as general fiscal management, operations, and day-to-day management, serving in a leadership role, working with our incident management team and starting the community health needs assessment, health improvement process, which, we intend to start here coming up in September. And then routinely meeting and providing support to current health department staff, including Laura as well, providing leadership throughout Dubuque County, and then being the point of contact throughout Iowa Department of Public Health, including submission of all reporting, contracting, required meetings, and grant applications. We went through a lot of that there in the Board of Health. And the health department will continue to work on the environmental health grants and projects, the CAID funding, the grants to county funding, provide fiscal management for the after action report, participated in community meetings traditionally assigned to department staff, continued management of their daily staff activities and scheduling, signing authority on all claims within the county health department, continued facilitation and management of the Board of Health meetings, and providing department updates at Board of Health, and then also assisting in the budgeting process. So I feel we we worked quite a bit on this on looking at who should be doing what, so there wouldn't be confusion with Laura and Bailey and the staff at the health department, and then VNA staff as well. This was kind of brought up and set about because we do provide health department services in Clayton County. It's a little bit different in Clayton County. Their Board of Health is more advisory rather than governing. So I felt that that probably wouldn't work well here in Dubuque County. And I like the system that we have here and the input and the governance within the health department or within the Board of Health. So some things are a little bit different compared to how we contract in Clayton County. But we certainly have the staff and the capacity to do this, some of which we're already doing. We just don't provide the leadership on behalf of the county health. And so we put together this addendum. As Sandra said, we sent it off to the county legal as well as our legal team here, and then brought it forth. Here we are. The salary and benefits that are in there, we did an estimation of hours and a timeline of up to 6 months, knowing that it could be shorter, it could be extended depending on how the search for the new executive director goes, but we thought we would start with a base, so then we're not coming back month to month going through this. We chose to do an addendum to our current nursing contract. I did reach out to Becky Nowacek and sent her all the information ahead of time to have her review and ensure that everything we have in this addendum also meets the Iowa code through the Iowa Department of Public Health, and asked for her input as well, which she did give some, and we added it in there. So I feel that we've done a good job at looking at our needs within the system and kind of moving forward from there. On a VNA standpoint, I feel that we're ready for this. We will do a great job. We've got a lot of staff here that would be participating. We look forward to expanding the leadership within the county and the health department, assisting the Board of Health in moving forward in expansion and providing additional and expanded leadership throughout the county. We already work with a lot of the grants, so we're in a good position to look at grants that might be available as we move forward to help bring on more people and focus on some of the areas that the health department has previously been discussing. We've already kind of been through the budgeting process through our other counties, so we're familiar with that process and feel that we can bring a lot there. And the same with the strategic planning. After some discussions with Sandra, I know that's a priority within this board, and we feel that we can help move that process forward as well.
Thank you, Stacy. I have a couple of questions and then I'll open it up for the rest of the board. The first one was, it's on page 2 under number 2F, and that has to do with the PIO. And I don't know if Mary Rose Corrigan contacted you at all, but she said that the city, and she's on with us tonight, I think. So she says the city does some of that, or the IMT does some of that. So we kind of have to sort that out. And I think what we talked about when Samantha was at the meeting with you and Laura was that we were going to try and keep things the same as much as we could. So if the city had been doing something for the county, then they would continue to do that or something like that. So do you know anything about that, Stacy?
I do. Mary Rose did share that with me prior, and we've had several discussions on it. And, you know, I will defer obviously to the board and your thoughts on that as well. But I do think that the city has played a large role, especially over the last couple of years in terms of COVID. Randy Gale and Mary Rose and their staff have a lot of resources that we have not had on a county level, and have stepped up to ensure that we're getting information out throughout the public. I think if and I don't want to speak for Mary Rose, but I do think that if they're more than willing to continue to expand to provide those services throughout the whole county, there is a benefit there.
Okay.
Randy has been wonderful to work with. Mary Rose obviously has been part of our incident management team and a part of this system as well. And so I think she is on and is probably prepared to speak on a lot of this.
Right, right. So, I mean, I think what the goal is just to kind of keep the jobs kind of the same as they had been. And so you would be, as far as the PIO for what you'd be doing, Stacy, would be more like if phone calls came in with questions or that Laura couldn't answer, you know, stuff like that, right?
Absolutely, and I would be working, I think, in partnership with Mary Rose as well as we have been for the last few years at making sure that information gets out and we get media requests and things like that. And I would be more than happy to step in on a county and do those interviews as well. And then, but there's so much more to the PIO piece than just that. And I
Yeah.
think that it would be worth exploring on the
Right.
board standpoint.
All right, thank you. And then just with the salary, if we should be so fortunate as to get a new director within a couple of months, and we then, you know, could terminate this contract, is this salary of 34,000 that would be prorated like on a monthly basis, you think, or?
I think we could set it up very similar to what we have now, where we bill as we use that time. We're able to separate anything additional that we're doing here that would be above and beyond what our current position is here at the VNA, and we can bill and invoice on a monthly basis as used. Because again, the hours that we put in there are estimated on what we think would come about in 6 months. But again, you know, you never know what comes into the future. So
Right.
it would just be, so it could be that it would not be spent all, or it could be that we would be coming back to the board because something catastrophic happened or something made some changes.
Okay,
So
I understand. Okay. All right, so let me just open it up to the rest of the board for questions or comments.
I guess my only question is, do we need to include a budget figure for the city of Dubuque?
That we will, the city has actually presented something to me by email today, so we're going to discuss that under
Okay.
agenda item number 7 or something like that.
Okay, I'm just jumping ahead. Okay.
Yeah, yeah. But good, you're astute there, Amy. Thank you.
I don't have
Okay.
questions. I would just say thank you to Stacy for your work in this matter and, you know, really coming through and helping in a difficult situation. So thank you.
thanks, Jess. We are actually very excited and really see a lot of good things. We've got a list of where we want to get started once this becomes official, and I think we can really provide a lot of good public health support that we haven't had the opportunity to before.
Cool.
Great. Any other questions from the board?
It looks like the auditor has a question or a comment.
Good, Kevin.
Good afternoon. This is Auditor Kevin Dragato.
Hi.
I also had a chance to look this over, and the contract looked great to me, and I'm very happy to have the VNA and Stacy to back us up in our time of need. There was one minor change that we were planning on advising Laura and Stacy with in regards to the claims approval process. In order to maintain segregation of duties within departments, any claims that would be initiated from the VNA subject to Dubuque County would need to go through Laura for approval and for authorization. So her signature is on there. And what that does is that sort of puts a wall between being able to issue a claim and approve your own claim. So that's
Okay.
really the only thing we saw on our end. And I don't believe that it requires any sort of reworking of this contract. I just wanted to put it out there so that everybody's aware that our office will be reaching out to Stacy and to Laura, and we will continue to offer any support we can. Megan's been helping with grants. So at any point that anybody needs anything, just feel free to reach out to our office.
Okay, thank you, Kevin. What about the salary part? How does that get approved? I mean, if we approve it tonight, then it goes to the supervisors, is that it, or?
That's correct. It will go to the supervisors for their approval, and I imagine that we will not need a budget amendment because we will already have funds allocated for that position. But that's a question for Stella Rundy, but it will need to go to the supervisors for final approval.
Okay, so then they could approve it as is, or they could make amendments to it.
They could approve it as is, they could deny it as is, they could amend it, or they could turn it back to the Board of Health for further review if they have questions.
All right, thank you, that's helpful.
No problem.
I guess that brings up another question for me. So the 38-1 is for 6 months?
That's correct, Amy.
Okay.
for 6 months, based upon sort of an hours allocation, right, Stacy? And if something happened where we had some sort of emergency or something, you could use up those hours pretty fast.
Correct.
Okay, all right. Okay, so is there a motion?
I move that we accept this addendum to the service agreement.
I
Thank
would
you.
second it.
Thank you, Jess. There's been a motion and seconded to approve this addendum to the Community Health Nursing Services Agreement. This is addendum number 1. Is there any further discussion? Supervisor McDonough, do you have any comments about this?
No, I understand the contract was reviewed by, we did have CJ review it as well, correct?
Yes,
County attorney?
I believe we did, yes. Yes,
No,
Stacy?
my concern was addressed by the auditor.
okay. Thank you, Supervisor. Okay, so any further discussion, board members? Hearing none, then all those in favor of the motion, say aye.
Aye.
Aye. Those opposed? Okay, the motion passes and we've adopted the Community Health Nursing Services Agreement, addendum number 1, and this will then now go to the supervisors. And thank you so much, Stacy, for all the help with that. All right, our next item is unfinished business, and the unfinished business is the hiring options for the executive director position.
And Sandra, I think you missed
Excuse me,
another
Sandra?
variance.
Yeah.
8C.
What? Okay, what did I miss?
The Haberlin variance.
Yep,
Oh.
so another variance.
That's not on mine, sorry. Go ahead.
So yeah, so I met with Paul and Kathy Haverland last month at their residence, 10531 Key West Drive. Just a little background. Right now, their system is currently failing and it's backing up into their bathtubs and sinks, which is a huge health hazard. They did work with their neighbor to try to get an easement for part of the new septic system to be installed on her property, but she declined, and they would need a variance to move forward with the installation. The property, it is a smaller lot. They are requesting a 5-foot variance from the septic tank to the property line and a 5-foot variance from the secondary treatment to the property line. Which the tank can still be, it's still accessible for pumpings. And Kathy, are you on Zoom? Okay.
Can you hear us,
Yep,
Bailey?
yep. So do you guys have anything to add?
Well, did you, Pat from Busing stopped out and sent a letter. Did you get the letter from him?
Yes, I did.
You did. Okay. I just wanted to make sure you received that. And, I guess our system was installed in 1966 when the house was built. So the tank was installed in 66. The lines are failing. We, like you said, we tried to do an easement and then it looked like they might sell us some land, and then that fell through, and we're just, we just need to get something done here.
Bailey, in your letter, it looks like you are in support of this, that you don't see any issues.
No, I don't. I think that I mean, it's failing, so they're really in need of, they need to install a new system soon. and the easement that they did try, they were actively trying, and their neighbor decided that she didn't want to go with that option. So this is really their only option.
Yeah,
So
and
what did-
anything that, we could install now would be better than the setup that we have. It's really old.
And Bailey, tell me again what the variances are. This is Sandra.
Yep,
What
so,
are-
so it's a 5-foot variance that they're requesting from this, it'd be from the septic tank to the property line, which the minimum is 10. And then a 5-foot variance from the secondary treatment to the property line, which the minimum is also 10. And that is, what Laura's sharing is just their home and their property, the lines, and you can see it's a smaller lot. So there isn't much room.
And so which property line are are they going to be close? Is it going to be close to a neighbor's property or?
No, it's not gonna be on the neighbor's property because they couldn't get that easement. But are you asking like which side?
Yeah,
it's
what
gonna be?
side of the house is it?
It is
It's on the
okay,
back.
the left, right? The left
It'd
side.
be out in the back by you could see the cornfield back in there. Yeah, right there.
Yeah.
The right, yeah. I'm looking at it.
Yeah, it doesn't look to me like there's much option in the way of installing this, and it has to be done. Adam, do you have anything to add?
I was just curious I know they didn't want to do easement, but did the neighbors have any concern about the 5-foot variance? Are they opposed to that, or do they have any thoughts on that?
So she did come in, and she talked to me about the easement, and she was concerned that, she didn't want to, do the easement because she was concerned that the value of the land would, go down, and, that her field would be, and like her field would be ruined if some of this drain field was on her field. But as for the variance, I have not talked to her about the variance. And this was probably 3 weeks ago that I spoke with her.
And you said it's going to be in the back right there. Is there any, but it's not going to be, it's going to be within, or it's supposed to be far enough away from that structure that I can see there. It looks like maybe a garage or shed or something.
Is it going to be far enough from there? Yeah,
I mean, yeah, you don't need a variance for that, right? So it's just, you said property line is the issue, not the building or structure.
Yep. So we actually Corey Groth, who's going to be installing the septic, he was out there as well, and he had we measured everything, and
Okay. Just
Yeah,
to
so
clarify
it's-
that. Yeah, thanks, Bailey.
and as for the letter from Beasing, I can share that. I don't know if I can. I don't have it right now. I could probably email it and show it to you guys that way. Is that something, do you want to see that right now, or?
What could you just give us what the gist of it was? Was it in favor, or were there concerns?
No,
I have a copy here. I could read it if you would like.
Sure. Yeah, that'd be great.
Okay, it's Dear Bailey, according to our standard practice, we completed a site visit to 10531 Key West Drive. Based on the size of the lot and the location of the home, we concluded that there would not be sufficient area available for an absorption field. It is our recommendation that a sand filter system or other type of alternative septic system is needed. And then he just said, if you have any questions, give him a call, and his Patrick Norton at Busing and Associates.
Is the sand filter what you were going to go with?
That's what we were hoping to go with.
Yeah, that's what they'll have to. It
Okay.
didn't perk, so they'll have.
Okay.
well, there wasn't enough, actually, no, I'm sorry. There wasn't enough room for an absorption system. So they have to go with the sand filter.
Okay. Well, I just don't see any reason not to grant this variance. I think you've tried everything you could to get it, within the 10 feet, and there's just absolutely no way you can do it. So you're doing the next best thing. So I would be inclined to put forth a motion to accept this variance.
Okay, is there a second?
I would second that.
Okay, is there any further discussion?
Yeah, I think you'd just be good, Bailey, to reach out with neighbors just to double check that. Because I mean, if they're,
Oh, yeah,
if they're
I
not
can
gonna be happy
absolutely.
with the variance, and I mean, especially if they think it's going to negatively impact their land, they're not happy with it.
Yeah, no, I can absolutely do that. I can do that tomorrow.
But I just want to add
Did you guys?
also,
Mhm.
I would like to add that, I mean, we're limiting our showers. We are taking our clothes to the laundromat. I mean, we are in a situation that we have no other choice. If we're not able to replace our existing septic system, I mean, we would have to sell our home. And the value of our home is going to be, it's going to affect the value of our home. So yes, you can ask our neighbor, is she concerned about the variance? But we're concerned about our home and our,
Well, your
what we
public
have
health, if it's
going on
backing
here.
up in your tub, yeah, I totally agree with you. Yeah,
Yeah,
I mean, that's
so-
the pressing environmental public concern is, literally in your house. I agree with that.
So, I mean, I don't believe that what Betty has to say should make or break the decision that you're going to make as far as the variance.
Okay, Kathy, we appreciate that. So we do have a motion with a second on the table. Are you asking for an amendment, Adam, that would put this off, or?
Yeah, I don't know what I'm asking. I'm just trying to
Okay.
think through it. Yeah, I don't.
Yeah,
Well, I think if Bailey and the person from Busing have both signed off on it, I think that the neighbor has absolutely no training or education with regard to septic. So I don't know that their opinion would really need to be taken into consideration.
What would be the alternative? I mean, so if we took the neighbor's opinion into consideration and it was that they were not in favor, what would be our alternative?
They might have to go with a cocoa system that might be smaller, but still, there still wouldn't be much room there. There's just, I mean, it's a smaller lot. There's just
not
really,
great for that. Yeah,
and I
you're
mean,
right.
they even tried to get on city sewer, and that just wasn't an option. So they did try a lot of different things.
And there would be absolutely no way you could sell that house with a malfunctioning sewer system. So,
okay, so we do have the motion with the second. Is there any further discussion? Okay, all those in favor of the motion say aye.
I
Aye. Those opposed? Okay, so this variance has been approved. Okay, now we'll move on to the unfinished business, and this we wanted to talk with the City of Dubuque Health Department and Mary Rose Corrigan. I think you're on. I received an email today just kind of laying out the parameters that Ms. Corrigan thinks that the city can continue to help the county with. So Mary Rose, do you want to go ahead and kind of explain it to the board?
Hi, everyone. Mary Rose Corrigan, Public Health Director for the City of Dubuque here. And first of all, I totally support the VNA taking on some of the director administrative roles for the county. That's a good plan and very appropriate. But I did want to point out to Sandra and the board that the PIO function is a lot more than just doing interviews and answering questions. And I provided a high-level overview of that to Sandra. And obviously you probably won't be taking action on this tonight since it was just given to you. Sandra and I had a hard time connecting over it, but anyway, we provided the city of Dubuque between our public information office staff and primarily myself have done most of the work on the public information dissemination in terms of print, social media, TV interviews, newspaper, media releases, daily updates, all of those things. And with the pandemic ongoing and a lot of uncertainty around that, I would think we would want to keep the ability to do some of those same things for that. Now, a public information officer is not necessarily the spokesperson. The public information officer prepares and does a lot of the groundwork for the public information. The spokesperson has been typically, Stacy, myself, or Patrice when she was here, and then Samantha, the content expert kind of thing that can speak to reporters or the public, that kind of thing. So the county doesn't really have a designated public information officer for the health department. And I think with everything that Stacy's doing, it would be tough for her to assume the role of this as it is functioning today. We have, and just to note, we're not doing near the level of work in this area that we did the first 2 years of the pandemic. So yes, it is manageable, but just for instance, when the new vaccine comes out, we're going to be doing a lot of work on that in terms of public information, and who knows what else happens with the pandemic or monkeypox or whatever comes up. So I wanted the board to know that there is the public information function is more in depth and contains a lot more activities.
Thank you. And then was there something with the incident management team too, or this is just?
Well, the way usually anything that was prepared for public information was vetted by the incident management team. We often together came up with the ideas or the needs for public information. And then I would work more closely with the City of Dubuque PIO staff to create and get that out. And then the incident management team approved what went out prior to it being printed or published, whatever.
Mm-hmm. Okay.
And we also determined when the city public information officer, Randy Gale, we created a system where all media requests went through him so they could be coordinated. And when he would get a request, he would put it out to us and we would determine who was the best person to do that interview or answer those questions or who was available. So it was kind of a coordinated system. We knew who was saying what. There wasn't conflicting messages.
Okay. And what your portion of what you think you would be doing for the county would cost what?
Well, I estimated a per cost and fringe rate hourly wage, and the same with our public information officer, Randy Gale. And we're estimating, between 16 and 18 hours a month for each of us. And that's kind of based on the current level of response and public information dissemination going on. It's a little hard to estimate. So just based it on an hourly basis to bill similar to how Stacy bills for the public health nursing. And so, yeah.
So it would be billed basically on an hourly basis, you think, or it would be billed like Stacy does?
I'm proposing an hourly. I don't know the details of how Stacy does her billing, but I know I think it's based on time. I'm not sure.
Yeah. Okay. All right. Well, I appreciate this information, Mary Rose. I was wondering if the board has any questions. We won't be able to take action on this tonight, but we can certainly have the county attorney review it and that type of thing if we want to go forward with it. So,
And Sandra, what I gave you is not really in contractual form.
okay,
It's a summary, so.
yeah. Well, if we do want to go forward with that, would that be something that you would provide for us, or we would get it, or we'd figure
Yes,
that out?
I would need to know the county's requirements on contractual kind of things, but yeah, we could work on that together.
Okay, all right. Okay, so are there any comments from the board?
Did we get an hourly rate? We got the how many hours it's expected, but did we get an hourly rate?
Yeah, it's on
yeah.
there.
Doesn't
I just,
matter.
I did just copy everyone on the email, but
It's $63.94 for the public health director and $60.89 for the public information officer per hour.
okay, thank you.
Sandra, this is
Yeah.
Supervisor McDonough. In the past, when we've worked with the city, we have done some shared costs over the pandemic, for instance, with regard to the isolation
Okay,
quarters that were there on a voluntary basis. But so it might be something that maybe I could be helpful with you as well.
Okay,
To
good.
walk through that with Mary Rose. You know, the contracts with the city supervisors might want to be involved in that early too.
Right, okay. Yeah, I understand that. So, but I think it would be my feeling at least that we would want this kind of public information to continue. So I think that a contract with the city to continue that until we get our director is appropriate. Are the rest of you, the board members, are you in favor of this too, or how do you feel?
My only hesitation is that it would be Dubuque focused. And while Dubuque is the largest city, there are numerous other smaller towns around Dubuque that maybe wouldn't be specifically included. So I guess I would like to see if we're paying for the whole county, if the whole county, you know, all the taxpayers are paying for it, I think they ought to get what they're paying for with specific information to their area.
So, yeah, and I don't know, Mary Rose, if currently you have like email blasts that you send out to the other cities in the county or how that's all handled. But
No, we have a daily weekly update, excuse me, for example, that is subscriber based. And I
Okay.
believe a lot of the smaller cities are on it. I could check the membership, but we could certainly work with them to subscribe to it. In the past, I know Patrice worked with the city clerks of the smaller cities to disseminate information, and we provided all the information for that. So we could, you know,
okay,
there wasn't separate messaging for different areas of the county. For the
there
most
was not, or there was?
No.
No, okay. Well, I think as we draw up the contractual relationship, we would just try to make an emphasis on making sure that there was out-county outreach, so. I think
I like the flexibility of the hourly stuff as well. So I think it's a good resource to have at our, at our disposal until we get new one hired. So yeah, I'm in support of it.
Okay, all right. Well, any other comments? Hearing none, then we'll get this formulated in a more contractual type of context and bring it back for next month.
Okay, thank you.
Thank you very much, Mary Rose. We appreciate your help. Okay, now, does anyone, I don't have a big update about our executive director search, but I do know that it's been posted, and I did verify with Ms. Berry that all the surrounding states, that all their schools of public health have been notified of this job posting. So Nebraska, Kansas, Missouri, all of those states. So hopefully we're getting some applications, but I really haven't heard anything. So, okay, are there any other, does anyone else want to talk about hiring options for the executive director position? I will just mention that it's been mentioned to me by a couple of different people in public health that we should really try to continue to think out of the box while we're doing this search. So just a little
Sandra,
update. Go ahead.
for Maureen is, I know last time we had kind of a deadline for taking applications. We decided to kind of go with a rolling process now or take them. So is there a date where we expect her to give us an update or?
I don't know that. I've not gotten an updated timeline from her. So
Okay.
I'll have to contact her next week and see, or tomorrow and see what she's doing with that. But yeah, she'll give us an updated timeline, I'm sure. And then we'll know when we can start interviewing people.
Okay.
Okay.
Sandra, this is Ann. Could I make a comment?
Yes.
So the candidate that we offered the job to did not have a master's in public health administration, correct?
Correct.
And I'm wondering if today I spoke to a person who is employed in our community and they had no idea that we were doing a search. I'm wondering if the conversation with Maureen shouldn't be, we have institutions here who have master's degree programs. Are we reaching out to nurse practitioners? Are we reaching out to folks who have their master's and even maybe a PhD in social work? I mean, I'm not sure that we're actually, kind of beating the bushes locally in addition to going out to a region. So that might just be another thought. Are we working with higher education? Are we sending it out to our networks of professors and alumni?
So you're talking about like our local Clark, University of Dubuque,
Right.
Loras. Okay. All right.
Yeah. They have robust healthcare fields and they have robust psychology and social work programming. And they produce, licensed folks all the time. So maybe something there with, doing whatever she thinks that outreach should be locally, that might even into Platteville. I mean, that might give us, some folks who just still don't know we're looking.
Right. Okay. I appreciate that, Supervisor McDonough, and I will call that to her attention when I contact Maureen. Okay. Any other comments from the board considering our executive director search?
Do we anticipate that we'll still have that small subgroup? It was just you and me.
I don't think we'll be able to because that would be a quorum now.
Oh, right.
You'll have new members. You'll have new members within the next 3 weeks. I don't know when you're thinking of, and again, everyone on the health board should be asking folks that you admire who bring skill sets to see if they could help the county at this time, and all of us, right?
Right. Okay. So I think if our board does increase before we have to start having meetings, then we wouldn't have a quorum problem. Why don't we just have, because I'm going to be gone most of September, so why don't we just have, if you're willing, Jess and Amy, do you want to just be the committee for September?
Sure.
I'm fine with that.
Okay, are you okay with that? Okay. And that way, if we have any updates from Maureen and we need to have a meeting with her or something, then you two can be the members for September. And then by the end of September, we should have our new members for the Board of Health. So, okay. So then let's go on to new business. Does anyone have any new business they would like to bring up? Hearing none, then board communications and reports. Does anyone have anything they'd like to talk about tonight or report? Okay, hearing none, then our next regularly scheduled meeting will be September 21st, 2022, and the time will be 4:30. That will be an in-person meeting. And Adam, would you be available to run that meeting?
Yeah, certainly, Sandra.
Okay, thank you. I appreciate that. So then we will go ahead at this time. Anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand on Zoom, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Are there any public comments?
Sandra, it's Ann McDonough again.
Yeah.
So I'll make a final comment here in this section.
Okay.
And I guess what I would like to say, Adam, you just agreed to chair that meeting, the annual meeting of the 2080 agreement for the watershed programs. I just got notice today that that's actually September 21st. And so, I mean, I've got a conflict with that, you know, obviously can't be everywhere at all times, but I didn't
Right.
know if that would present a problem for you as well. Sometimes you're even a guest speaker at that 2080 watershed event.
Yeah, I don't know. I have this one on my calendar and I didn't have that on my calendar. I'll have to reach out to Eric. Yeah.
What time is that meeting?
Ann?
Yeah, I'm looking here to be sure. I think it's scheduled like from 4 to 7 or 5 to 7. It goes right over basically the Board of Health. I wasn't given advance notice to comment, because I would have blocked the time out myself and moved it to a different date, but I wasn't consulted.
And Adam, you're usually at those.
Yeah, I usually presented those. I could do a taped presentation or present later in the meeting if we need to, or we could move our meeting. Yeah,
I mean, we could move our meeting, so.
I would be available any evening that week if we wanted to switch nights, or the previous Wednesday also.
Is it possible maybe that Sandra and Adam could kind of offline view about this and make that decision? We will have, obviously we need a quorum, but Adam, you give valuable information to all the stakeholders that come to that meeting as well.
thank you. Yeah, I could work with.
What
Sandra.
about having it on the 28th of September? I still wouldn't be available, but I mean.
That's actually the night of, Dubuque is hosting a statewide water conference, you know, showcasing the watershed work that we're doing, and that's here in Dubuque this year. I'm sure, Adam, you're probably in and out of that as well.
Right.
Okay. Well.
Does the 22nd, which is a Thursday, does that work for anyone?
No, I'm busy on Thursday nights.
The 14th?
14th works for me.
Same here.
I think the 14th works for me too.
Yeah, the 14th would work for me. I'm also
Okay.
Yeah.
All right. Well, why don't we go ahead and move the next regularly scheduled meeting to September 14th?
Same time.
Same time, 4:30, and that will be an in-person meeting. Okay?
Sounds good.
Sounds good. Thank you. Is there a motion to adjourn?
I'll motion.
Okay.
All right, we've had a motion and a second to adjourn our meeting. All those in favor say aye. Aye.
Aye.
All right, those, we're adjourned. Thank you very much, everyone. Take care.
See you in September.
All right, bye-bye.
Thank you all.